Good afternoon. My name is Elizabeth. I'm one of the nurses here at Caregiver Health Services. And you are?
Michelle
And what is your last name, Michelle?
Pratt.
Okay, and can you tell me your date of birth?
May 3rd, 1998.
Okay, and it looks like you are coming to Providence to be hired as a physician's assistant in the family medicine program, correct?
Correct.
All right, and your start date, it looks like, is on the 10th of March.
Correct.
Okay, great. Well, what we're doing today is just reviewing your vaccines to make sure you're up to date on all your vaccines. And so what I did is I went ahead and I pulled the vaccines that you brought with you and I wrote them down on our little check sheet here. We'll kind of go through this and see if there's anything that's missing or anything that you need. So first of all, I just want to double check to make sure you're not having any symptoms of communicable disease. So are you having any fever, chills currently?
No.
Okay. How about drainage from your eyes, sore throat, runny nose, congestion?
No.
Okay, great. Cough, nausea, vomiting, new loss of sense of taste or smell?
No.
Okay, great. And any recent diarrhea, muscle pain, acute fatigue?
No.
Okay. And how about new or unusual headache, shortness of breath, difficulty breathing, or any open sores, wounds, rash?
No.
Okay, perfect. Great. So the reason that we check that is we just want to make sure that you aren't exhibiting any communicable diseases that could be transferred to our patient clientele. And we ask if you are ill to make sure that you notify your supervisor. We do have a communicable disease policy, and I can show you where that's located on our SharePoint site. In the event that you had any symptoms, you could kind of look that over and find out what you need to do and if there's any kind of a work restriction for you. We also, since a lot of these symptoms are similar to symptoms of COVID, we do have a COVID testing policy. And we ask that if you have any of those symptoms that you do test for COVID, and there is a whole protocol on what to do for that.
Great.
If you are positive, then we would ask that you would call our call center, and they would determine whether you could return to work and at what date. So, all right. And then the other forms that we had you fill out, so we asked you about tuberculosis, and this is just a risk assessment and screening that we do. And it looks like you are not having any symptoms of tuberculosis, cough, productive cough, any low-grade fever, blood present in sputum, night sweats, unusual fatigue, loss of appetite, unexplained weight loss of 5 pounds or more. Okay. And no recent shortness of breath, we kind of already asked you those questions, or chest pain?
No, none of that.
Okay, or hoarseness, unexplained hoarseness more than 2 weeks?
No.
Okay. And then as far as history, it looks like the only history that you checked yes on was that you you went to New Zealand last summer. That sounds like a fun trip. So, but you've never had any positive TB testing done, skin testing, or positive blood testing, correct?
No.
Okay, great. So, first thing I was going to ask you about is allergies. It looks like you did check that you are allergic to latex, and latex gloves seem to be the issue for you.
Yes.
Okay. And it looks like you checked that you have a skin reaction. You get kind of red. Your skin gets red and itchy, and that you've also had some respiratory symptoms of asthma when you've worn latex gloves, correct?
Yes.
Okay. Yeah, so in that case, what we will do, we will talk, well, actually what I'll do is I'll give you a form that we would like you to have your provider fill out just to check, to see if there's any kind of restrictions that you would need when you're in the workplace. We really don't use a lot of latex products anymore, and we don't use latex gloves typically in most areas, so we'll give you that information to take to your provider. We also have a sheet just about latex sensitivity and what the symptoms are, and I'll just hand that to you now. And this is something that obviously latex allergies can worsen over time, so we just want you to be aware if there's any situation that comes up in the workplace that would require you to use different equipment or be in a different environment, then we just want to make sure that you're safe. All right, and then we'll draw the TB blood test, the QuantiFERON Gold. We just do that one time, we don't repeat that unless you have a TB exposure. So, and we'll give you a lab slip to take the lab after we're done here. And then COVID vaccines, you had the initial vaccines. Did you ever have another vaccine for COVID after that?
No.
Okay. So what I'll do, I'm gonna have you just fill out a COVID declination. And in the event that the CDC recommends the newest or latest COVID vaccine, but we have you sign this to release you to work. We don't give it here, so that's why we have you do that. If you decide to get it, you could get it at any pharmacy and then bring us a copy and we could add it to your employee health record. Great, all right. And then it looks like you've had one MMR vaccine and one varicella vaccine. You probably had the vaccines when you were a child, but maybe just don't have the records, is that?
Yeah.
Okay. So what we do typically in that case is we'll just draw titers to see if you're immune. So if your titers come back positive, it means you're immune. If they're negative, then we would recommend getting a second either MMR vaccine, depending on what's negative, or a second Varivax vaccine if you need a chickenpox, if your chickenpox titer comes back negative, so we'll do that. There is a form that we have you fill out for that, and that is basically, we'll draw these titers for measles, mumps, rubella, chickenpox. I'm also adding hepatitis B on there because you've had your 3 Hep B vaccines, and we usually like to draw a titer to make sure that you are immune to Hep B. We'll email you these results if you have any negative results. If your labs are normal, you won't get any email from us. But we do recommend following up. And reason being, if you ever were exposed to any patient that had any of these diseases, you want to make sure that you're immune. Otherwise, you could be off work for an extended period of time, and they do have you use your paid time off for that exposure period. So I'll just have you initial here, 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 and sign at the bottom there. Great, and then I'm just going to give you a copy of this so you have a copy. And then the other vaccine, it looks like, is Tdap, which you've had, so you're up to date on that. That's good for 10 years, so you had one in 2020, it looks like. And how about a flu vaccine? Have you had a flu vaccine this season?
No.
Okay. Did you want to get a flu shot?
No.
Okay. I'll have you sign this declination. Just so you know, during flu season, if you do decline the vaccine, there is sometimes a masking requirement when you're doing patient care. To prevent you from spreading the flu in the event that you were exposed to it to the patient. So.
Is it just the normal mask? It's not an N95?
Yes, it's just a regular mask, not an N95 mask, correct. Great, all right. And then the other thing we'll do is a color vision screen. So we're just checking for red-green colored blindness with this test. And what I'm going to do is show you this book, and you just tell me what you see in the picture here. You can just say the number for this one.
12,
Mhm.
8, 5,
Correct.
29, 74,
Mhm.
7, 45,
Yep.
2.
Do you see anything in there?
I don't see any number
Okay,
on that
that's
one.
correct. Nothing.
16.
And then this one you can trace in the error from the X to the X with your finger. Just line you see. Yes, correct. Good.
35, 96.
And here's another tracing one. You can just trace it in the air with your finger.
Top line, bottom line.
Yes, great. All right. So you are not colorblind, so that's good.
Good to know.
Most people know if they are, probably by this time in their life, but every now and then we'll find somebody who's colorblind and they don't know it. So, and then we'll have you do a fit test after we're done here. So we'll review how to, what that requires for our respiratory protection program. We discussed the communicable disease guidelines. I'm going to show you a couple things just to quickly review where you can find things. They will go over this during your orientation, so I'm just giving you a visual of what you might see. So when you go onto the SharePoint site, your SharePoint site will say Providence Medical Group, and if you click on Caregiver Service Portal, that'll take you to a page where all the HR links are, and they're all in one area. And then this is our apps dashboard. This is an icon that is on the computer, and in our pamphlet, this sort of talks about caregiver health, what we do here in our department. Also, there is a survey that you can complete when we're finished here on your experience with us. But this is the apps, or my apps dashboard icon. So if you click on that, this is kind of nice because each thing is individual and it's pretty easy to navigate. So Pure Safety is actually where your employee health records will be, or caregiver health, I should say. And if you ever need a copy of those, like for school, you can print them out from here. So anything that we do, titers or vaccines that we give you will all be located there. And then we've got My Choose Well. If you click on this, there's some good resources. And what's nice about that is pretty much all the information about the benefits are there as well. So all about our health insurance benefits, caregiver health services, our SharePoint site you can access it here. Retirement information is here. Leave and work injuries, if you ever had an injury at work, this is where you would fill out paperwork, and information about well-being. So it's kind of easy to find.
Awesome.
Yeah. And I think once you get, onboarded and you click around, you'll be able to access this. If you do have any questions about any of our HR links, you can always call this number during these hours and they can help you out. And then we have a workplace violence reporting tool as well. So if you ever have a situation where you feel threatened or you're having any situation, if a patient is verbally abusive, we really are encouraging people to report that. We have a great security team here, and you can always contact security if you have any problems as well. So our body fluid exposure protocol is on our caregiver health SharePoint site. So you can access it either on the on this page or back on the other Choose Well page. And if you click on caregiver health services here, it'll take you to a page, and if you click on body fluid exposures, it tells you exactly what to do. If you don't remember anything, the most important thing to remember is to make sure the patient gets their labs drawn whose blood you were exposed to. Because if we do not have a blood sample, then it's really hard sometimes for us to get that patient to come back to have their labs drawn. And in the clinic setting, that can be an issue just because if they're discharged from the clinic or going home, we just want to make sure that we get that done before they leave. So that's critical. And then we follow up, or the nursing supervisor would follow up with you with results in the hospital and call you and contact you. And they would give you the rapid HIV results. Sometimes the other labs take longer to get back, so we would follow up with making sure you get those results as they come back. But that's kind of the most important thing.
Gotcha.
And again, on the back is just information about our call center. You can always contact them if you have any questions about if you're positive for COVID, or if you've been exposed to a communicable disease, you might get an email from them and you would just need to follow up with them.
Okay.
Do you have any other questions that you can think of?
No, I think you covered everything.
Okay, great. Well, welcome to Providence, and we'll have you follow up with Carmen to do the respiratory fit testing here in just a minute. Okay, so Michelle, I'm going to hand you, this is the paperwork that we will need to have you have your provider fill out and send back to us, either email or fax to us, and the numbers are on there for both as far as email and fax. I'm going to also just give you a business card. If for some reason you were able to find your other MMR or your Verivax vaccines, you could always send those in to us and we can add them to your employee health record.
Perfect.
And then this is, again, our brochure, and there is a survey here that you could fill out, and it will help us evaluate how we do here in our department to make sure that we're giving you the kind of service that you would like.
All right.